In order to do computer-guided implant surgery with the static guides, we need these paraphernalia available with us. One, this is a universal drill guide, which has got drill of different lengths and different sizes. Then you've got the spoons of different width and different hole widths, etc. And then, of course, you have got the implant insertion tool also. You also get from them a guideline which tells you exactly what size drill to use, what length of the drills are being used in what sequence, and subsequently this is what you're going to apply when you're going to do the drilling, and this is what we are going to start today. As you will notice, my guide is placed in the correct position. It's stable. I can see that the fitting is good, but in this case, as mentioned earlier, I have not stabilized it. You all will be stabilizing it with a pin. My colleague, my assistant, will help me hold this in place. Since we know that I'm going to use the 17 drill for all my different types of sizes of the drill, I have got the spoon as specified by, just leave this, as specified by the company. I'm going to use 17 drill. D1, this is 17 And of course, the drill is now stabilized, it's in place. Just go in and get into the full length of the drill without fear. After having done that, normally what I do is I remove the spoon and remove the drill and have a look at the hole. And I confirm that everything is in its correct place. For any reason, as I've already explained in the lecture, for any reason, if I find that the hole is not in the correct place as I need it, I will change my plan. I will not use this further because along the line something has gone wrong, which has been gone wrong either from the CBCT side or from the translation of this CBCT by the software, whatever. But here I believe everything looks good. So I'm going to come back to its place and proceed with the next drill, which is in this case is a 2.85. Now, since I'm doing an implant of 3.75, I will be finishing at 3.25. Okay. I'll use the second drill, again the 17 but this time the 2.85. Go to the next drill, which is 3.25, which should be good enough for my implant. I have completed that drilling and now I'm going to remove this, and as you will notice, my hole is perfect. My implant drill hole is perfect and I'm quite happy with it. And if I put a depth gauge here, start. And as you can notice, my depth gauge and the angle, if the camera can come a little bit on the side, you can see that the angle is going approximately 30 degrees. Approximately, not exactly, but approximately 30 degrees. In the same way, I'm now going to complete my first implant, my straight implant. Starting with the first drill, which is in this case a 2.0. You will find it a little bit tough in this case going through the cortex because the beef cortex is a little bit thick. But once having done that, you will notice it just slips in. So you might encounter a little bit of toughness there. We now go to the second drill, 5. Oh, this is 3.25, right? Subsequently, it should be very easy. Just to show you the holes, how they have been drilled and how neat and clean they look. And if I put my depth gauge, you will notice this is going in a very, very good direction, straight. And the second one, if I just put a small in, you will notice that I've got a tilted implant and I've got a straight implant. Subsequently, I'll be finishing one on this anterior as a straight implant and then posterior as a tilted implant. This is all on 4, and this is how you can actually use a guide to get all on 4 implants in the correct predetermined position. Implants, they come in a box with an attachment like this, wherein you can actually get the implant holder from the Unidrill kit, Multidrill kit rather. Take it in the, this is in the box. So once you're connected there, you can just bend a little bit and it breaks. You'll notice you've got the cover screw also attached in the same way below the implant. I will now insert one implant using the AxisGuide for demo. Start. Can I have the this one, please? I will now insert the second implant. Where is the second implant, please? Show you manually, but I've shown you one with the guide, one I'm showing you manually. Just want to show you the angle in which the implant goes in. Very patiently, very slowly. I have finally placed my implants with the final torque of 40 using my ratchet, insertion tool and the ratchet, and I have achieved the implant in the correct place. Now this is up to you. In the beef rib, of course, it's going to be a little bit tight, but in the human mandible, human jaw, it will be in the correct place. This is just for a case of demo, which we have shown you.